evening with Doordarshan. I'm Sakal Bhatt and you're watching Doctor's Chat, and today we're going to examine, if at all, there is any relationship between COVID and neurology, between COVID-19 infection and any sort of neurological disorders. And the larger picture, whenever we think about COVID-19 and its impact on the psychological balance, the psychology, the mental health, the psychiatric aspect, nervousness, loneliness, anxiety, etc., all that that comes with COVID-19 and mental health of an individual. We're going to talk about that in detail and basically examine COVID and neurology in great depth. And to do so, we're very glad to have with us Dr. M.V. Padma Srivastava, who doesn't need much introduction. She's Chief of Neurosciences Center of the Premier Institute of AIIMS, All India Institute of Medical Sciences National Capital, also a recipient, Padma Shri recipient. And also, for those who might not be knowing this, she's one amongst the few at the very onset of pandemic who went ahead and volunteered for co-vaccine trial. Thank you so much, ma'am, for talking to us on Doordarshan. It's always a pleasure to have you with us on our show, but this is your first episode on Doctor's Chat. I'm going to start with a very basic and a very simple question. What do we know? Because now we are done with the so-called second phase of the COVID-19. So what do we know about the effects of the SARS-CoV-2 and COVID-19 on the nervous system? We will talk about the psychological and mental situation or issues later, but scientifically, what evidence do we have? What is the correlation between neurological disorders and COVID?
Thank you, Sakal. Actually, this is a very relevant question, especially since at this stage of pandemic, we now know for sure that COVID is much beyond a respiratory system illness. Initially, it was all thought to be part of ILI, what we call as influenza-like illness, or SARI, which is severe acute respiratory, illness. So now we've gone beyond that. Last year, when this whole thing manifested in front of us, the initial publications started coming, or I should say the knowledge came from Wuhan, China, wherein in admitted patients with SARS-CoV, they found that people developed brain attacks or brain strokes. They developed coma or encephalopathy, they developed a brain infection and various types of paralysis. And at that time, it was thought that maybe it is a severity of the illness, and during an ICU admission, these complications came in. But after that, we realized that even at the onset, the very presentation of COVID need not be fever, cough, and breathlessness. They came with loss of smell, loss of taste. So which means that this virus has some kind of a predilection, what we call as neurotropism. It seems to like the nervous system. So it could enter the nervous system through the nerves which subserve our smell. And it goes straight to the back of the brain, to the base of the brain.
So there is a direct connection between COVID virus and brain. That's interesting. So
there are a lot of hypotheses which then came forward, and some hypotheses have been proven, some are still under research. But we've seen even in India, especially in the second wave, that we've seen people presenting with strokes or brain attacks, nothing like an ILI. And when they did the COVID testing, they were all positive. And later on, they developed even CT features of pneumonia-like illness. So a spectrum of neurological illnesses have now been demonstrated for sure with COVID infection, which includes brain attacks or various clots which form in the body. It may be in the blood supply to the brain, blood supply to the heart, to the various other organs besides lungs. Also various varieties of paralysis, infections of the brain, and also what we call as demyelination, like post-infectious problems which are probably related to some autoimmune phenomena. But what is more interesting, Satkal, is that even after COVID recovery, you must have heard of this long COVID.
Yes.
There's a constellation of features which are now being seen in survival of mild COVID. This term called mental fog essentially means confusion. A loss of executive function means those things which you could do with alacrity, with kind of taken for granted thing. I mean, we always did these things. Those kind of things became much more difficult. Multitasking was becoming much more difficult. There were some memory issues and a general confusion, so loosely called as mental fog.
So can this be seen, just to understand it further, you talked about initially loss of taste, loss of smell were those, red flag symptoms. And as we gradually moved on, now will these things that you're talking about be identified more as symptoms, or this is something that COVID-19 in a particular body can trigger these neurological disorders?
So under the hypothesis, one, as you rightly said, is a direct entry of the virus into the brain. So that could be, over along the olfactory nerves. Yes, that is one thing. The second is, as a result of COVID infection, this infection has a way of triggering some body problems like systemic infection. You must have heard about this, Atkal, this immune reaction. Then that's where the steroids had come in a very big way,
yes,
right?
Yes.
So in that immune reaction, people have seen the cytokine storms, clotting disorders of the blood in general. So they have a tendency to clot in a lot of vessels. So thereby also brain could get affected. It could be because of the cytokine issues, lot of inflammations happening. The whole body is inflamed, and so also the nervous system. And then you have the blood vessels getting, compromised by a lot of things. We won't get into, the nitty-gritty. It becomes too scientific. But also the involvement of heart. Heart is being involved. So when the heart becomes involved in either the heart muscle or the rhythm, the heartbeat, the irregularity of the heartbeat, which is one of the reasons for sudden deaths some people have had even in the recovery after COVID. In that situation also, the clots which are formed in the heart can get pumped into the brain. So there are various reasons, implications of the systemic involvement of COVID, which may involve the nervous system, and also autoimmune. This term is something that I think even a layperson now understands. Autoimmunity, that is, the body's defense becomes offensive.
Okay.
You're hosting a whole lot of kind of a war in which even the normal structures of the body gets, affected. So this autoimmune phenomena by itself may be one of the reasons why we have seen this spectrum. But interestingly, what is under research even now is that over a period of 6 months, 1 year, 2 years perhaps, will these people go on to develop some degenerative diseases like dementia, Alzheimer's, Parkinson's, and I'm sure you heard of these terms before. Because Alzheimer's...
But they are like the 60 plus.
Not really.
Traditionally.
Traditionally, yes. You hit the nail on the head. Traditionally. But then what is seen in these disorders is also loss of smell predates a lot of these, degenerative diseases. So therefore, the research is now active. In fact, there are some very recent publication on this as well, where they looked at serial MRIs in people, in big cohorts, in big registries. You have the MRI of the brain pre-COVID, and some of them had COVID. So in the COVID survivors, they repeated an MRI, and they found that there is shrinkage of those areas of the brain which subserve the function of these memory issues. Okay, so it's still a learning curve. I don't think we have all the answers yet. COVID is something which is teaching us new things.
It's no more confined to your respiratory tract.
Yes, exactly.
No, what I want to understand is masking. Now, this, I don't want to cause any panic, but this is very serious as well. You would agree that can COVID directly impact my neurological function or system? So in that case, will only masking prevent my neurological system to get affected by COVID?
So if COVID infection per se is being prevented, then I think, we are safe. Holistically will be safe. Now, mask is something which is very interestingly you put up. And I must say that, there were a lot of issues about mask also. Okay, when we put on mask, maybe we get hypoxia. Now that's been negated. They said that no, you will not become hypoxic if you put mask. Yes, it is a constraint people, when we are not used to having something on our face all the time, and humid climate, hot, when it is, obviously it's not a very pleasant thing to do. But when you get used to it, please remember, Satkal, that vaccination or our personal, I must say, let me use a Hindi term here, a kavach, or for us an armamentarium would be not just a vaccine. Mask is a vaccine, and of course our COVID appropriate behavior is also a vaccine. In fact, this whole thing will probably protected us, and will also protect us from whatever the COVID is likely to throw at us even in the future.
Yes, since you talked about vaccine, ma'am, you were the first few amongst many who volunteered for vaccination. Now, when we talk about neurological problems and does COVID-19 vaccine trigger, there is a lot of there are some unconfirmed reports. I think there's a lot of information out there in public domain. People allegedly experiencing some sort of unexplained neurological illness following COVID-19 vaccine. Let's get it on record loud and clear. Is there any relation? And have you had such cases?
Right. So the first part of it is the trials. So whenever we have all these questions, which are very valid questions, and as an aware and educated member of the society, you would have these, is it safe? Is it effective? So, but to answer those questions, you need trials. And for trials, you need volunteers.
Yes.
So, a lot of times what we have is that people would stand on the bank and ask the questions and not actively participate in the process wherein you can get those answers. So they would expect somebody else to volunteer and give them the answers so that they can get their answers. So I wanted to dispel that. And as a health worker, it was my responsibility to come forward. Then there will be far more people coming forward to volunteer because it was necessary to get those answers. And now we have these publications, and the last one I think came very recently, where the overall efficacy was 77% according to the publication, and against the severity of illness was more than 90%. And that is what we would be more, concerned about, that even if we do get this infection, just let it be like any other common flu and not become severe and lead to hospitalization and death. So that seems to be protected by more than 90%. I think most vaccines are doing, all vaccines are doing that, and that is what is being done. Now coming to the side effects. Yes, we've had some reports and published reports, especially from the other parts of the world, and there have been some, the regulations in certain countries where they're regulating the vaccines to certain age groups, certain types of vaccines to certain age groups, and also there is definitely a directive which has been said that, look, if you have a problem, check with your physician. So if there is a problem like a bleeding tendency, if there is a problem like a clotting tendency, check with your physician before you take the vaccine, which I think is a very logical thing to do. But saying that, oh, this vaccine is likely to do this, so please don't take vaccination, is a wrong statement.
And have there been cases?
So the cases have been reported from the rest of the world. And
okay.
I'm not saying
in India.
that in India there is a specific body which is actually looking into all these. In fact, the other thing I want to say, Satkal, is because vaccine is such a program where it is being under scrutiny, under a microscope. So every small thing is actually being recorded. And mostly what has been published so far is a side effect like any other vaccine. Like, you have fever, you have local pain, you have some tenderness, you have some URI, and it's okay, and you just take paracetamol. Said that though, there are problems with even in any vaccination per se. There could be some issues which may happen, but the frequency of those issues is less. So when you look at a larger good, then you're looking at the fact that there are millions who are protected. There may be few hundreds who may be affected. So which is true across most medical interventions. And that is true for this. So nobody is saying that Per se, there would never be a side effect, never be a problem. They may be, but they're very far and very, very few. And we have the ICMR publication too,
Okay.
which has actually said that it is something like 0.02% and 0.04%, are very, very small percentages. So therefore, largely we should say, we should take it that yes, if you have a concern, if you are on any medicine, if there is a clotting or a bleeding problem, please check with your physician before you take the vaccine. But by yourself, don't hesitate and don't decide and run away before, from vaccination.
While I was doing my prep for this bit of, COVID-19 vaccine causing neurological problems per se, I came across this study which talks about Guillain-Barre Syndrome.
Guillain-Barre Syndrome.
Yeah, well, what's that?
So the GBS.
Guillain-Barre Syndrome.
Yeah, Guillain-Barre Syndrome. This is GBS. This is a type of paralysis. We talked about paralysis. So the paralysis could be single nerves, which may be from the brain, like what we call as cranial nerves. Very commonly, we'll have, facial palsy, there would be some deviation of the eye, stuff like that. Or it could be involving paralysis of hands and legs. Now, Guillain-Barre Syndrome is a type of a paralysis which is rapidly evolving, and in a short duration of time, it can involve both hands and legs and the person can be paralyzed. Said that, GBS is a known entity. It is seen with any post-viral infection. It is also seen with any vaccine.
Yeah, what is
I'm not talking of COVID alone.
Yeah,
any
what
vaccine.
Is the relationship with the this GBS and vaccination, COVID vaccination?
So that's what. So this is again said to be an autoimmune pathology. Okay, we talked about autoimmunity also. So this is again an autoimmune phenomena, and this is seen with any vaccination. It's been described for almost like last 100 years.
Okay.
So GBS is a syndrome which is known to happen with infection or with vaccine with some preceding problem, autoimmune, and it is treatable. It is nicely manageable. Yes, it is described with any again I'm coming back to that, with any vaccine, and it's been described even with COVID-19. In some parts, it's been reported. So the whole spectrum which I described to you, COVID and post-COVID, all this starting with brain attacks, coma, encephalitis, meningitis, you have this various varieties of paralysis, Guillain-Barre syndrome, as well as some degeneration, mental fog. All of them have been described and very well published now. It's in the public domain in published literature.
Okay. So there's no need to panic. There's no such concrete evidence which suggests that if you go for vaccination, in some cases it might trigger these plethora of neurological problems.
Circle, I must say this, that this plethora, you very aptly use that word, the plethora of neurological features as well as GBS is more with COVID infection and post-COVID than with vaccines. So, when you balance it out, then we always say, do you want COVID or you want to take, look at that minuscule, problem with vaccines. So always, you must avoid the COVID. All of these have been associated largely with COVID and post-COVID.
Okay, now let's just get out of the brains and neurons and talk about the human behavior, the psychological aspect of it. And ma'am, what's my next question going to be?
Yes.
Mental health issues, yes.
Absolutely. I think that is the biggest casualty of all.
Yes.
So you have, and that spectrum is so wide. We'll have to go away from those who have been affected with COVID and post-COVID. It starts off with living in this pandemic, and it's across the entire spectrum of ages. School children, adolescents, young people, older individuals, everybody. The lockdown, when you're looking at the social, demographic, and economic aspects of the entire pandemic, the decisions that had to be taken, which were very, very, difficult for all, charters of the societal fabric as such. Also, trying to walk the tightrope walk of balancing out what would be safe versus what is actually practical and livable. During the lockdown, we've seen demographics amongst even the in homes itself, the relationships, all of them have had taken a toll. And there's in fact, there's a lot of research which went into it, the gender bias and even others. And I think largely it's I would say the disruption of the happily chugging along society which we were all part of in the last whole century, because this came in after one whole century, is what really threw everything out of
went haywire.
Said that COVID, and this is one infection wherein you couldn't be with your loved ones. You couldn't hold your
quarantine, isolation also triggered frustration, loneliness, anxiety, uncontrolled fears. Yeah.
Even the COVID patient who's there in admitted in a hospital. Now he's looking at people walking around in PPEs. All of us look like somebody, some kind of astronauts from some other planet. You couldn't see the faces. So that human touch, however much people try to do it, and the family is so anxious. And then even when somebody died, the whole family couldn't go for a burial. You see, these issues were unheard of, unthought of. So I think the mental health was one thing which probably everybody needed some kind of counseling and some kind of hand holding. So anxiety, depression, frustration and confusion had become all pervading, and I truly believe that this is one aspect which is probably still ongoing and across all ages as well. And apart from that, there's a host of neuropsychiatric spectrum also that people are looking at in post-COVID.
How do you differentiate the two, ma'am? I was psychiatric issues, psychological issues.
Yeah, so when you're looking at a behavior pattern, so the behavior pattern, it's a continuous spectrum. The behavior pattern could be because of an organic pathology. Say, for example, supposing my oxygen is low, then I may become drowsy, I may become berserk, I may be confused, I may be unable to understand. Okay? Now, I may become berserk also if I have excessive anger, frustration. Okay? And that kind of a steep anger, frustration may be part of a spectrum of primary psychiatric, like a manic depression, a psychosis which is primary, or secondary because of a pathology like oxygen or a sodium or a glucose or an infection or those issues. So behavior can be all pervading either this way or that way, and we are able to distinguish this by looking at it if it is a pure behavior syndrome or it is associated with other constellation of neurological features. Anyway, to make it less complicated, I must say that behavior issues have been very common. Besides that, primary, what we call as neuropsychiatric. Now, when we bring in psychiatry, it is a disbalance of certain hormones and neurochemicals and neurotransmitters. Even that is also being documented by functional imaging and very amazing functional neuroimaging markers, which we call. So those are, and that's active research, and you probably will get more answers in the coming few months, maybe a couple of, maybe
fantastic.
A year.
Dr. Padma, it was such an absorbing conversation. I need to wrap it up, unfortunately. Final word, ma'am. Final word, just to dispel any sort of misinformation, vaccination, triggering neurological issues, etc., etc. What's your message to the country?
Yes, please. So, as responsible citizens of an aware society, it is a responsibility of each one of us to contribute and get rid of this pandemic. So, for that, we don't need to be told what to do. If we are disciplined, we won't need lockdowns. And we can beat this wave, be it third wave or a fourth wave. It will just be a ripple or may never come. If we adopt that vaccine is a shot, vaccine is a mask, and vaccine is a COVID appropriate behavior, we can beat this pandemic.
And mental health, stabilizing it further?
Yes, and for mental health, most important would be science with empathy, means that stay positive. Things will only get better.
Basically, invest in positive emotions. Thank you so very much. It was such a pleasure having you, Dr. Padma Srivastava on Doctor's Chat. Thank you, and please
Thank
take
you.
good care of yourself. Namaskar.